Hi there, I'm David Butler. I've been with Noi for 35 years and I'd like to introduce Luke Bongiorno. Hi there, Luke.
G'day, Dave.
Tell
Thanks
us a
for
little,
having me.
Yeah, pleasure. Tell us a little bit about yourself and where you've been.
Where I've been?
Yeah.
Gosh, that's a good question all over. I graduated as a physio in Melbourne
Yeah?
back in 96, and then I've lived the last 20 plus years in New York.
Yeah.
That's where I met you in 2005.
I remember that course, you kind of stood out.
So I was teaching, it was it was called hands-on physical therapy.
Yeah.
Or hands-on seminars.
Yeah.
And it was teaching trigger point courses back then, and then you came and gave a presentation. I'd seen you before, but I've always been interested in pain science and, looking at a more biopsychosocial approach, even to the manual therapy that I do.
Right, so you're principally a clinician and you've had practices in New York.
Yeah, I've had practices in New York, so I'm still a clinician. I love clinical practice. I have a hard time seeing myself not doing it. And that, I think, helps my teaching, and I think my teaching helps my clinical practice.
Yeah.
So I had... we had a practice in New York, New York Sports Med was the name. We started that in 2007.
Yeah.
It was acquired in 2015, and that's when I started teaching
For Noi,
for Noi. Yeah.
And look, over the time, has your clinical focus changed in that time? Because you're principally a clinician. Has the focus changed?
It's a good question, Dave.
Sorry about that. Yeah.
No, it's a good one, because it definitely has. And while I started my career in Melbourne in 1997, I was working at then Bethesda Hospital, now Epworth, dealing with multi-trauma neuro-ortho population, so a lot of head injuries. And I was always fascinated with, you remember the T6, with the neurodynamics approach and looking beyond the joints. So, while I can say that I've always had a focus of looking at the body as a unit, the shift for me has been integrating that with a more biopsychosocial approach, say, rather than a pure biomedical one. And then, with the new science with the immune system was very intriguing to me, and part of my thirst for teaching was also selfishly wanting to learn more about it. And figuring out ways to bring that information to patients for them to understand
And
their conditions.
Luke, I hear the sporting community seeks you out for help.
Well,
how did that happen? Why don't they seek me out?
Well, I'm sure they would come over. I'll share some of them with you. Look, it sort of happened by accident. I never saw myself as a sports clinician. In the early days, I was more probably neuro-focused. However, and when we started our company, we actually named it CPW Integrative Medicine. So that stood for Central Park West. It was where we were located in New York.
Beautiful place.
Beautiful, absolutely lovely. And had a nice little view, and I thought, the people we would attract it was a different community. It was a whole range. And one of the guys that I was in business with at the time said, well, why don't we hone in and change our name? So we changed it to NY Sports Med, and that attracted a large group of athletic patients. A lot of people run in New York, not necessarily professionals or elites at that point. But I think what I started to think about, well, what sort of patient do I really like to see? And it's those that are wanting to remain active. And I think that's the
Isn't that all of us?
Well, yes, it is all of us, but also helping people seeing themselves as an athlete. Work with some of the oldies. Oh, I used to be this and I used to be that. Well, you still are that. But then through that and different relationships with orthopedists and surgeons, I guess people that had these elite athletes that had multiple recurrent knee traumas and recurrent injury patterns, which are essentially workers' comp patients, highly paid workers' comp patients. But I started to sort of develop a bit of a niche for that, and I think that brought me into the MBA and different communities, and that's how I sort of got involved in sports medicine.
Excellent. So, do you see? This is probably an odd question, Luke, but I can ask you this: any great difference in your assessment of a very high-level basketballer to someone like me who might have just fallen off a ladder on the weekend?
Well, there you go. It's actually a great question.
Well, thanks.
I think, really getting a good history, which, we know listening to the patient and that part of it is pretty similar. And I think sometimes, these athletes, we don't necessarily think of them. We see them as these powerful, very confident humans. But when they're injured, that's a whole part of their being that's...
So you mean they're not much different to me?
No, they're the same. They're still
thanks,
humans. And, you said falling from a ladder. Well, one of the big things that I'll look at is tests that they may not have been accustomed to, like simple balance tests, getting them to close their eyes, things that they wouldn't have done as part of their general training. And for an athlete, if they see themselves as say, oh, why is my right side not as good as my left, for example, balancing, or why does it change when I close my eyes? Those are very similar types of tests that I'll utilise rather than just your basic range of motion and strength test. So that part is similar. I may not focus on looking at traditional tests that they've done, particularly also if they've had recurrent injury. They're looking for an approach that's slightly novel or a little bit different. And I would think in large part my first work in the US was with nursing homes, and I think working with the elderly population in the community has helped me deal with athletes. They have the wisdom, and I think
that's quite a diverse background, from neurologically injured, the nursing home, standard manual therapy, and the
chest PT. I didn't
putting it together.
So
look, there's no doubt there's, let's call it an explain pain revolution out there now.
Yes.
The increasingly and rapid recognition of the value and the power and the potency of knowledge, of education. How's that fitting into your work now?
Well, I think now with a large amount of information available, and with the idea of neuroplasticity and a lot of people seeking knowledge and being empowered with that, I think there's definitely a shift. Patients are increasingly asking questions. They're not necessarily just accepting, a doctor or a medical diagnosis. And I see an amazing opportunity in the explain pain worlds to deliver effectively knowledge in the right dose.
In the right dose. So the storytelling, I'm hearing you say, can fit really quite nicely around the manual handling, the touch. It blends in. Yes,
I wouldn't consider myself. It's not a hands-on or hands-off type approach. It's all of that. The power of human touch. Sorry, Dave.
That's all right. Anytime.
The power of touch can be a really great point to connect. And I think using that as one of your tools can be a nice way of delivering that education. Even saying, oh, why does it hurt up here? Well, the nerve passes down here. You can use an anatomical approach, but just a way to spark curiosity.
I like the sound of that. Where do you see treatment for sports injuries happening in the future? Have you got a projection? Where's it going to happen?
I think if we look at, you've got an athlete or a sports person or someone interested in sports, and their activity, and I think it's natural, particularly for them to sort of focus on, well, here's my injured part. What's wrong? What's the cause? And recognising that they're a human, which we all know as clinicians. You got a human being there with their body part, and I think now the idea of them understanding the brain's involvement in pain and pain as output from the brain. If that message can be delivered through whatever modalities and tools and using multimedia and modern technology, VR, different ways to actually get them to immerse themselves or feel those experiences and feel the connections. Oh, wow, my knee's less sensitive now after doing some breathing. They're things that they wouldn't have necessarily done. And I think the more we start to look at even an elite athlete, if you're working with them, as a human that just needs to understand their story. You mentioned story before. Everyone has their own story, and our job as a clinician is to help them make sense of their story. So acknowledge the knee or the shoulder or whatever body part, and give them a story about why they might be having the same issues. And that's just, these are young men and women
who can take it on, can't they?
Yeah, they can.
And I think we're probably getting a bit better at getting that story out, and the liberating power for someone surely at high level sports who maybe suddenly think, hang on, that pain doesn't necessarily mean I really injured that badly. That pain doesn't mean I need to stay off the court for so much longer. There's a lot of other things. Everything matters, we say these days.
And you can use their story and help them understand. It's hard. Often athletes, they're very confident, but again, when they're injured, that level of confidence drops. But their persona as an athlete, it's very hard for them to sort of change that a little bit. So, for example, I had an NBA player, and he said, well, I can do, this is just looking at how he perceived his ability to go on the court.
Yeah.
And he said, well, I can do one-on-one, no problem. That's one-on-one is just one-on-one running up and down a court.
He said, I'm not much into
that's
just
all right.
running up and down.
Running one-on-one, playing, shooting the basket.
Yeah.
He said, but I'm not ready my knee's not ready for 3-on-3. Now, 3-on-3, there are other forces involved, but in terms of running load, if you've got 6 people on the court, there's less running than if you've just got 2 people on the court. Would that make sense?
Yes, I guess.
So helping him understand, well, as far as your knee's concerned, there's probably going to be less force, and speaking in that language of just logic and common sense, there might be less force doing that, but there's more cognitive load. You've got to look around. So your brain has to process a lot more information. And that might be a way in to sort of challenge their thinking in a constructive way.
But a really powerful way into all sorts of things.
Yeah,
it's not just on the court, it's life. It's everywhere, isn't it?
Of course, yeah. So just
Luke, it's just great to have you with Noi, and looking forward to doing a lot more teaching.
Yeah, absolutely.
Yeah, particularly in the US, or you can do it anywhere now, can't you?
So in the virtual world that we're in online, you can just pick your time zone and...
That's great.
I love it, yeah.
Enjoy it.
Thank you, David.
Enjoy it, and thanks for that. That was really, really interesting and great stuff to get out there to the world.
Yes.
Go for it.
Thank you, David.